Good day, everyone. I'm Xanda Hilger, and I coordinate the North Central Texas Area Agency on Aging and Dallas Area Agency on Aging teleconnection. Today, we are joined by a high energy, very knowledgeable woman to talk about Medicare preventive services. She's very passionate about this topic, and as I read her resume, she is a certified benefits counselor two with the Area Agency on Aging of North Central Texas. Prior to being
Yes.
employed with the Area Agency on Aging, she was a volunteer benefits counselor for many years. Felicia assists clients with Medicare Part A, B, C, and D, Medicare savings programs, Medicaid, Medigap policies, extra help, preventive services, and so much more. She attended the University of Texas Denton and holds a master's degree in gerontology. Felicia is a film noir enthusiast and a jazz blues
Yes.
aficionado. Welcome, Felicia.
Thank you so much, Xanda. I appreciate that introduction. I'm so glad to be here today, and I am passionate. So, if it sounds like I'm shouting, I'm not actually shouting. I just want you all to know about preventive services and how they can help you and your loved ones. So, let's get started. I will share my screen and we will go ahead and get started. I have to, there we go. Does everyone see my screen?
Yes.
Okay. All righty. I think I have to go back. There we go. And all right, it's still there.
It's still there.
Okay, great. All righty. I've clicked on too many buttons here. All right. Thank you so much, everyone, for taking out time from your busy morning for this webinar, this session. And I'll talk starting about the Area Agency on Aging. This is our main benefits counseling team, and we are the Area Agency on Aging North Central Texas Council of Governments. We are known as SHIP, which I'll explain shortly. But we also partner with the Texas Senior Medicare Patrol to provide information on fraud and abuse. And we often talk about fraud and abuse in some of our presentations, but we leave that to the Texas Senior Medicare Patrol to do that. And this is just a little snapshot. There's like 54 ships in every state. There's one in Puerto Rico, Guam, which I want to go visit, and DC and the Virgin Islands. And our local programs, our counselors, and we have served, and I know this number is dated, over 4 million individuals. We also perform others services. We help recruit and train volunteers and in-kind team members to provide program services. SHIP team members are highly trained and certified to assist people in obtaining coverage through options such as Original Medicare, which is Part A and B, Medicare Advantage Plan, which is Part C, and our prescription drug plans, and also the Medigap. So SHIP also assists beneficiaries with limited income to apply for programs such as Medicaid, the Medicare Savings Program, and extra help, and it helps reduce their healthcare costs. And also we conduct, such as today, outreach by providing presentations, distributing information, and conducting enrollment events, such as fairs, senior fairs, and other community events. Just give us a call. SHIPs are federally funded. The SHIP program was established by Congress, and their work is funded through the U.S. Administration for Community Living at the U.S. Department of Health and Human Services. And SHIP we work with state offices, local agencies, and providers and help people understand the cost. We help people compare options. We can also enroll. If you tell us what you would like to enroll in, we can help you with that. And we also help with appeals. If anyone has ever had a Medicare appeal and they want to get the billing corrected, we can help with that. We'll go on to the next slide. And here's a little video of our volunteer opportunities, and I hope it'll play. It's just a short little video.
Many people find Medicare confusing. Make it easier and make a difference. Volunteer with your local SHIP and help people in your community navigate Medicare. You can volunteer virtually or in person, one-on-one or in groups. There's a wide variety of volunteer roles. You don't need a background in health insurance to get involved. SHIP provides the training.
I don't get paid for this. I'm a volunteer. And I get more out of doing this than what I did on a paycheck.
It's just a joy, a blessing to help and to give. And it doesn't take very much of your time.
If you go through the training, you give it a chance, you'll see the value not only for yourself, but you'll also see the value in others who you're able to assist.
As a SHIP volunteer, you can give back to your community, stay connected, and build your skills. Contact the SHIP office in your area to learn more. Depending on your area, the SHIP program may also be known by one of these names.
All right. Thank you for listening to that little video. And this is our web page for the SHIP to help you find your local office. SHIP also helps us with best practices. They help develop tools and new products for us. And then they provide one-on-one assistance to us also. And so we'll get right into it. Your annual preventive visit is one of the best ways to take care of yourself. So you just don't wait until you're feeling sick to go to the doctor. And this presentation will provide an overview of the Medicare preventative services, including covered wellness visits, screening, vaccines, eligibilities, requirements, frequency, how often you can go, the potential costs, and explain how these benefits support early detection. And I said early detection and your overall health. This presentation also offers practical guidance on how to access these services and make the most of your Medicare coverage to support your long-term health and well-being. The Medicare preventative services should help you, I'll help you identify which of the following is for you, which preventive services are covered, who's eligible to receive them, when preventive services are covered, and how much you pay, and where to get more information. As we all know, many Medicare beneficiaries skip preventive services. Millions of Americans are covered by Medicare, but absolutely a staggering number never take advantage of the preventative services designed to keep them healthy. Key screenings and vaccinations go underutilized despite being covered at zero cost for you out of pocket. The results are, and we must say, are preventable diseases go undetected and untreated. When beneficiaries don't know what's covered, and then they don't ask what's covered, and we have providers who don't always tell them. And also, Medicare here in 2026 is set to continue some to continue some, and in some cases, expand its focus on preventive services and wellness care. CMS regularly adds and expands these services through coverage determinations and physicians' fee schedule updates. For example, the recent changes have broadened colorectal cancer screening options, and they've also added HIV PrEP and have expanded vaccines to the preventive services list. And for more information, you can go to your Medicare and Medicaid services, that's CMS. So if you have original Medicare, you'll pay nothing for most preventive services. If you get the services from a doctor or a provider that accepts assignment. Assignment, and I'll explain, is an agreement by your doctor, provider, or supplier to be paid directly by Medicare to accept Medicare approved amounts in full as payment for coverage of services and not to bill you for any of those, any more than the Medicare deductible or coinsurance. If your doctor or other healthcare provider performs additional tests or services during the same visit, and that visit is not covered under preventive benefits, you may have to pay a coinsurance, and the Part B deductible may apply. Later, we'll go ahead and discuss how you may have to pay a coinsurance. So this is just a reminder for those, I talked about original Medicare, but for those who have a Medicare Advantage, always stay in network. Always ask your health provider before any services are performed if they are in network. So here's a list of what's covered. And that list is really extensive. I'm not going to be able in this time to go through every one. I've picked some of the major ones, and we'll go through those. So talk to your doctor or healthcare provider to decide which services are right for you. So from that list, you decide. You receive a welcome to Medicare preventive visit called the initial preventive physical examination. And it's a great way to get updated information on important screenings and vaccines and review your medical history. And that's, you're going to hear me say over and over, having that frank, open, honest conversation with your doctor about your health status. And this initial visit is only offered one time during the first 12 months of getting your Medicare Part B. During your preventive visit, your doctor or healthcare provider will perform the following services: review your medical and social history related to your health, take your blood pressure, your height, your weight, and body mass index, perform a simple vision test, review potential risk factors for depression, review functional ability and level of safety, which means it's an assessment of hearing impairment, the ability to successfully perform activities of daily living, your fall risks, and home safety. You'll get advice to help you prevent disease and improve your health and stay well. And of course, your doctor should give you a brief written plan on, or like a checklist, letting you know which screenings and other preventive services you need. And there's no cost if your doctor accepts Medicare assignment, or unless your doctor performs other additional tests and services. So we'll go to the next slide. Your annual wellness visit. After you've had your Part B for longer than 12 months, you can get a yearly wellness visit. to develop or update a prevention plan just right for you. Medicare covers the wellness visit every 12 months. You don't need to get the Welcome to Medicare preventive visit before getting your yearly wellness visit if you choose to. Medicare will cover a yearly wellness visit at no cost to you. You can work with your doctor and just have that open, honest, frank conversation with your doctor as your health changes or over time. Advanced screening is included if you need to have that, and you'll pay nothing for the exam, again, if the doctor accepts assignment. And so we'll start at one, the abdominal and aortic aneurysm screening. And it's a one-time, it's an ultrasound for people at risk. You must get a referral from your doctor. As we know, the aorta is the largest artery in your body. It carries blood away from your heart, and when it reaches your abdomen, it is called the abdominal aorta. The abdominal aorta supplies blood to the lower part of the body. When a weak area of the abdominal aorta expands or bulges, it's called an abdominal aortic aneurysm. And these develop slowly over many years and often have no symptoms. If an aneurysm expands rapidly, tears open, or blood leaks along the wall of the vessel, serious symptoms may suddenly develop. For this one-time screening, for the ultrasound, you must get your doctor to give you a referral. It can be your doctor, physician's assistant, nurse practitioner, a clinical nurse specialist. And you're considered at risk if any of the following apply to you. If you have a family history, you're a man 65 to 75, you have smoked at least 100 cigarettes in your lifetime. And again, you're a person with Medicare who has other risk factors in a category recommended for screening. So please, please talk to your doctor. Alcohol misuse and screening counseling. Medicare covers an annual alcohol misuse screening. Various screening tools are available to determine alcohol misuse. Medicare doesn't identify a specific alcohol misuse screening tool, but rather the decision to use a specific tool is at the discretion of the clinician, and it has to be in a primary care setting. So that's in the doctor's office. So those who screen positive, Medicare covers up to 4 brief 15-minute face-to-face behavioral counseling interventions per year for people who have screened for alcohol misuse. Breast cancer screening. Breast cancer is the most frequently diagnosed non-skin cancer in women. It is the second only to lung cancer as the leading cause of cancer-related deaths among women here in the United States. Every woman is at risk, and the risk increases with age. A screening mammogram, an X-ray of the breast used to detect early detection of breast cancer in women who have no signs or symptoms of the disease. And this procedure is done in the doctor's office. Medicare provides coverage for the annual screening for a mammogram for women with Medicare who are over 40 and older. And Medicare also provides coverage for one baseline screening mammogram for women ages 35 to 39. So it's best to always get that mammogram, have that open, honest, frank conversation with your doctor about your family history, with breast cancer. And of course, and if your doctor judges by your history and other significant factors that a mammogram is appropriate, then of course you go ahead and get that. It saved your life. Medicare covers bone mass measurements to prevent to measure bone density. These tests help you and your doctor choose the best way to keep your bones strong. Osteoporosis is a disease which your bones become weak and are more likely to break. And it's a silent disease, meaning you may not know you have it until you break a bone. Bone mass measurement is covered once every 24 months or more often if it is medically necessary if you are at risk of osteoporosis. And this is another big one, cardiovascular disease screening. Medicare covers this. Of course, you check for your cholesterol and other blood fat levels. High levels of cholesterol can increase your risk of heart disease and stroke. A lipid panel test that includes total cholesterol, high-density lipoproteins, and triglyceride levels are covered once every 5 years for all people with Medicare who have no apparent signs or symptoms of cardiovascular disease. In original Medicare, there is no cost if the doctor or other qualified health care provider accepts assignment. For Medicare coverage, again, you can go to medicare.gov and check out the coverage for cardiovascular disease screening. And also there is some behavioral therapy. Medicare covers intensive behavioral therapy for cardiovascular disease, and it's to reduce your risks. People with Medicare who are competent and alert at the time of counseling provided is important, and that counseling is furnished by a qualified primary care doctor, or other primary care practitioner. And of course, it's in a primary setting. So if you have cardiovascular disease, they will talk to you about how to make corrections. And of course, that's always diet and exercise, which they recommend, but they can make that more personalized for you. So cervical and vaginal cancer screenings. Medicare covers the Pap test, which is the pelvic exam, and the clinical breast exam. And these are done, of course, they're covered by Medicare. This test provided for the purpose of early detection of cervical cancer. It includes a collection or sample of the cervical cells and the doctor's interpretation of the test. And of course, this screening can detect fibroids, which are benign tumors in women of childbearing age, precancers, genital cancers, infections, and STDs, and also other reproductive system abnormalities. So go to the next one. And these are some of the ones that are not covered: cervical vaginal cancer screening. And these are performed in the doctor's office. And most women, however, they're covered under this, whether you need to get it every 24 months or every 12 months, if that applies. If you're at high risk for cervical or vaginal cancer, based again on your medical history, having that frank, open, honest conversation with your doctor, or other findings, or you're of childbearing age and you've had an abnormal Pap in the past 36 months. Colorectal cancer screenings. Again, in the United States, colorectal cancer is the fourth most common cancer in men and women. And if it is caught early, it is curable. To help find precancerous growths and help prevent or find cancer early, when treatment is most effective, your doctor may order one or more of the following tests if you meet certain conditions for the screening, such as the fecal occult blood tests, the screening colonoscopy, the barium enema. The doctor has many tools. Medicare defines high risk of developing colorectal cancer as someone who has one or more of the following factors. Uh, This is again, I'm sorry, I sound like a broken record, having that frank, open, honest conversation with your doctor. If you have a close relative, and that's a sibling, a parent, or a child who has had colorectal cancer or polyps, a family history of polyps, personal history of colorectal cancer, personal history of inflammatory bowel disease, including Crohn's disease, talk to your doctor. For people with Medicare at high risk of developing colorectal cancer, the frequencies and the coverage of the screening test varies for those who are not considered at high risk. So have that talk with your doctor. And these slides also contain some of the screening tests. If you are, if normal risk is covered once every 12 months, as you can see, if you're at high risk, and it just goes down the list. I have a couple of slides with that. So just take a look and see how that you can help uh, get those tests done by having that, again, that open, honest, frank conversation with your doctor. All men, and this is the prostate screening, are at risk of prostate cancer. However, the causes of prostate cancer aren't clearly understood. So through research and several factors have been identified that increase your risk include some of the following. Again, that family history of prostate cancer, men 50 and older, a diet of red meat and high-fat dairy, and of course, the smoking. Medicare covers prostate cancer screening, the tests, procedures for early detection of prostate cancer once every 12 months for all men with Medicare, 50 and older. And also, second, the most common screening used by doctors is the prostate cancer for prostate cancer screening is the PSA test, the prostate specific antigen, and that is definitely just a small draw of blood, and they can tell you what your PSA is. And if it's high, then that's something you need to look at. And of course, the PSA test must be ordered by the doctor. And again, you pay nothing for the screening. And it's so important that you and encourage your adult sons, if there is a family history of prostate cancer, to get these screenings done. And that way it is caught early and it's more likely it is curable. So lung cancer.
Felecia,
Yes, ma'am.
could we kind of pause for a moment? You're
Sure.
doing a lot of information, valuable
Okay.
information. And
Okay.
those of you that haven't noticed on the chat is all of you are going to receive this entire presentation in a PDF format. So you'll have all of the information bullet by bullet that you
Right.
can take to a doctor or talk with a loved one. Also got a quick question, Felecia.
Sure.
Are these
Yes.
services only for those on Medicare? My dad is on Medicare Advantage plan
Yes.
with United Healthcare. I'm unsure if he's eligible for all of this. I
Yes,
know
he
that there's
is.
ongoing confusion about that.
No, it is Medicare Advantage, and Original Medicare also
Mm-hmm.
offers preventive services.
Mm-hmm.
Just have her dad
Mm-hmm.
talk to the physician and get some of those tests, set up. Because if he has concerns over some of the things that I have talked about, especially
Mm-hmm.
prostate cancer, cardiovascular, if he has a family history, please talk to your doctor about that. If smoker, please talk to your doctor.
Okay.
Those tests are available whether you have original Medicare or a Medicare Advantage.
Okay. Great. Thank you. All right.
All right.
Lots of information here.
I
And it
know, and
certainly is a
it's
lot easier to see it on a screen in a PowerPoint presentation than to look through
yes.
the book,
Oh, yes.
through the Medicare 2026 book. So I would
And
encourage people
yes.
to maybe make copies of this
Mhm.
and keep with your book.
Yes, definitely. The book has a pretty good section in there about the preventative services, but you can go down the checklist, and I'm sorry I'm harping on it. I sound like my mother, but if you have that open, frank, honest conversation with your doctor about your health status, um, talk to him or her about it. And if you're concerned, have that test done. And like with this lung cancer screening, if this had been available, this probably could have saved my mother's life because Medicare covers lung cancer screenings with an X-ray machine that scans the body and uses low doses of radiation to make detailed pictures of the lungs. And you get that once per year for people who meet all of the criteria. You don't have any signs of cancer. You're 55 to 77. You are either a current smoker or have quit smoking in the past 15 years, have a tobacco smoking history of at least 30 packs a year, and that's an average of a pack a day for 30 years. And you can get a written order from their doctor or a qualified non-physician practitioner, and you can get this lung cancer screening test. I think it's so important to do that.
And who would a qualified primary care practitioner? Are you talking about a nurse practitioner or
Yes, mhm, clinician.
a physician
Mhm,
assistant, someone
yes,
like that? Okay.
yes. And this is not talked about enough widely, but it is a fact that sometimes get depressed and sometimes it lasts longer. So Medicare covers an annual screening for depression for people with Medicare, and it must be in the doctor's office, which is the primary setting that has staff assisted depression care supports in place to ensure a accurate diagnosis and effective treatment and follow-ups. Various screening tools are available for screening of depression. So you would
Is,
talk to your doctor.
may I
Mhm.
ask about that? Is that now required by Medicare at least once a year? I haven't heard of any physician that doesn't do something like that. And the tool they most often use here is called the PHQ, the Patient Health Questionnaire 9,
That's right.
is used by the World Health
Mhm.
Organization. Is that
Yes.
fairly common? What do you know about
Yes. I would suggest when they're asking those questions,
that?
because uh, the physician's assistant is
Mm-hmm.
usually getting you ready for the doctor. So
Uh-huh.
they're asking you, have you been depressed? Again, have that open and honest, be honest with yourself if you've been depressed. And they'll ask you in the last 2 weeks, have you felt depressed or have you felt suicidal? Have that, say if you do or you don't. Just, it's so, I know it's difficult to admit something, but this could lead to a better outcome for you. And it's important that if you are asked those questions and you want to say yes, be assured that that information is not going to, it's not going to be presented to the world. But depression is real, and people need to understand it's not the stigma that it was many years ago. So it's important to talk about it. And Medicare makes it easy if you need counseling or medication to help. That's important that you get that. I just always encourage through the webinar and when I talk about preventative services, this is to encourage you. Let Medicare work for you instead of you working for Medicare. So it's important. So we'll go on to the next slide. Another one, diabetes is a disease which your blood glucose or sugar levels are too high. Glucose comes from the foods that you eat. Insulin is a hormone that helps that glucose get into your cells to give them energy. With type 1 diabetes, your body doesn't make insulin. With type 2 diabetes, the more common type of diabetes, your body doesn't make or use insulin well. Without enough insulin, the glucose stays in your blood over time. Having too much glucose in your blood can cause serious problems. It can damage your eyes, your kidneys, and your nerves. Diabetes is the leading cause of acquired blindness among adults in the United States. Diabetes can also cause heart disease, stroke, and even the need to remove a limb. People at risk are those with high blood pressure, high cholesterol, high triglyceride levels, obesity, and a history of high blood sugar. And Medicare covers diabetes screening for all people with Medicare with certain risk factors. Again, that's that open conversation with your doctor, whether it's for diabetes or you've been diagnosed with pre-diabetes, such as people who are 65 and older, overweight, have a family history of diabetes, and a history of gestational diabetes or delivery of a baby weighing more than 9 pounds. Talk to your doctor, and you should get tested. If you have pre-diabetes, Medicare covers a maximum of 2 diabetes screenings within a 12-month period. So I encourage individuals to talk to your doctor and have, if you need that test, maybe you're diabetic. So just talk to your doctor. And I detest shots, but I get them. I got my flu shot because I was around a lot of little kids and they bring home everything. Influenza, also known as the flu, is a contagious disease caused by influenza viruses, generally during the winter months. They came over at Christmas and sneezed on me. It attacks the respiratory tract in humans, the nose, throat, and lungs. Influenza can lead to pneumonia. Medicare Part B provides coverage for 1 seasonal flu shot per flu season for all people with Medicare. Glaucoma is a group of diseases that damage the eye's optic nerve and can result in vision loss and even blindness. And some forms of glaucoma don't have any symptoms. So you may have the disease even if you don't have any trouble seeing or you feel any pain. So I encourage individuals to get that glaucoma test. And of course you should if you have diabetes, a family history of glaucoma, you're African American, 50 or older, or you're Hispanic, 65 and older. And your doctor can do that test for you in the office in a primary care setting. Hepatitis B is a serious disease caused by the hepatitis B virus. The virus can affect people of all ages. Hepatitis B attacks the liver and can cause chronic, lifelong infection, resulting in cirrhosis, which is the scarring of the liver, liver cancer, and liver failure, and even death. Medicare provides coverage for hepatitis B vaccines. It's a series of shots. And people who are at high risk, people with end-stage renal disease, individuals with hemophilia, individuals with diabetes, and also clients of institutions of developmentally disabled people who are institutionalized, individuals who live in the same households as a person with hepatitis B carrier, men who have sex with men, illicit injectable drug users. So, well, if you have talked to your doctor, have that open, honest, frank conversation. And of course, the COVID-19 vaccines are available if you have original Medicare or a Medicare Advantage plan. And smoking. Tobacco use continues to be the leading cause of preventable disease and death in the United States. Smoking can contribute to and worsen heart disease, stroke, lung disease, cancer, diabetes, hypertension, osteoporosis, macular degeneration, abdominal and aortic aneurysm, and cataracts. Smoking harms nearly every organ of the body and generally diminishes the health of smokers. Medicare covers counseling to prevent tobacco use. And if you are a smoker or if you have a loved one that's a smoker, Medicare will cover up to 8 to 8 face-to-face smoking and tobacco counseling visits for a 12-month period. And tobacco counseling services can be provided in the hospital or on an outpatient basis. And here is the Medicare.gov landing page. If you have not used this tool, please create an account or go on as a guest, and it's a wealth of information for you. You can find health plans, you can find providers, and even you can talk to someone, you can chat with them. And also Medicare is open 24 hours, 7 days a week. They only get about 4 holidays off, and they are there to assist you.
We're coming
So,
up on 10:47,
yes,
Felecia.
yes, I know. Please schedule your preventive visit with your personal doctor or PCP and talk
I'm
to your
sorry.
doctor about your well-being and your physical health and well-being. Thank you so much.
Well,
And
we know we have questions, and that's a lot
sure.
of excellent. It's prepared and presented very well.
Oh,
A couple of things that you and I were talking about before we got started.
mhm.
The role of someone going with you and
Oh,
this whole
yes.
idea of recording sessions. Would you
Yes.
address that?
Yes, I know it's hard, very difficult when you have to go to the doctor, and I'm just using, something from my personal life to go to the doctor, and your adult child wants to go with you. and they're unable to because they're working or they have children. Um, Talk to your doctor when you go in and you have your phone and ask them, can you record this conversation, this visit? Because, like me, when my daughter asks me, and she's quite nosy, she asks me about how did your doctor visit go? And I thought, well, it just went really well. Well, what did the doctor say? Ah, so there you have the recording. It might, if that's something that you want to do, and with your doctor's permission, just record the conversation so you can take it home to your adult children or your spouse and talk about this is what the doctor says. I'm doing well, um, and what other plans he has suggested, and that should work out. But as Xander was saying, some physicians might not like that, but just ask permission first before you
Ask
record.
permission. I
Ask
was
permission.
telling Felicia that one of our doctors, a specialist, has now posted in each exam room and at the front desk that recordings will not be allowed. And I didn't have the presence of mind. There were too many other things going on to ask what was the
Right.
reason for that. But that can make so much difference rather than having to scribble your own notes or
Oh
to
gosh.
recall what was said.
Yes.
And that person that goes along with you, especially those of you who have a spouse or someone with dementia or Alzheimer's, they may not have the details that you do.
Yes, it's so important. And I know we're both caregivers. It's difficult, but definitely I would ask the doctor, can I record this? Because I have to give an explanation to
Mhm.
the adult children, whether
Mhm.
they're they live here in Texas or they live in New York uh, or Maryland, as my adult children do.
Mhm.
So,
Questions,
yes.
questions.
Mhm.
Are our listeners overwhelmed or they just want to review everything? Felicia, I also offered a little bit about the depression issue, because as we know,
Yes.
many people will not admit to that word depression,
Yes, I
but
know.
wanted to assure everyone that the tools that they use ask questions about thinking and behavior and whether or not you feel that you're a danger to yourself. They don't, it's very well thought through, and these are all
Mhm.
evidence-based. They've had
Right,
a lot of research behind them. They're not just pulled out of the air.
right,
But I
right.
know with our practice, they do it every year, on our
Yes,
annual, every year.
every year. Yes. And it just goes to having that open, honest, frank conversation with your doctor. Just
Hmm.
talk that your doctor is your advocate,
Hmm.
and it's important that they know what's going on with you, and you
I
don't
want to
have to
ask our
keep that.
listener what
Mhm.
one question or one thing that you dialed in on that um, was answered today. We have a question: as an alternative to recording a visit, could an adult child request to be added to the My chart to gain information?
Yes, I'm
Absolutely.
definitely. Mhm.
Hmm.
And the same way with adult children should, in some cases, have access to their parents' Medicare.gov account because the account will tell you what medications they're on. It will show their doctor visits, their insurance, especially in a crisis. That if you have a Medicare Advantage plan, of course, you can go to an emergency room if you need to, but if you will want to know what plan they have so you can stay in network with their services. And
The
that's
follow-up
important.
question, I'm sorry, I
That's
stepped
okay.
right over you. A
That's good.
follow-up question is, do you have to be the power of attorney
For,
to be
and
to get onto my chart?
I don't believe so. When you
I don't
set your
think
account
so.
up, you can share it with
Mhm. Whoever.
whoever you choose.
Mhm. Melinda, did you have a question?
Oh, hi, Melinda.
I see a hand raised, but I don't know if she's
Hello.
saying
I
hello
just
or
I just had a comment.
Uh-huh.
please.
To be on my chart as an adult child, you do not have to have power of attorney. I believe that I still had to go through my mother's account or her, I think it was her email. They sent a link and then I had to approve that or a code or something. And then I was
Okay.
able to access her my chart.
Mm-hmm.
So yeah,
Awesome. Yeah,
we have done that. So
Thank
just
you
it's
yeah,
for that.
wanted
important.
to share.
hmm It's
And
important to have that access because in emergencies, the children are running around trying to find what's going on, and if it's readily accessible, it just calms their
Mhm,
nerves. It's very some cases, but
mhm.
you are the best judge of that if you wish to share that information with your adult children.
A follow-up question to that one was how about to be on the Medicare account? Do you have to have the POA? And it sounds like that perhaps, ma'am, it might be helpful for you, Ms. Teachin, to contact your local area agency on aging benefits counselors. It sounds like you do have some questions and maybe write those down and call and ask to speak with a benefits counselor. But in terms of that, Felecia, do you have to have POA to be on the Medicare account? You're not really on the account, but
No, your
access to it.
access to it. If to start the account, you need your red, white, and blue card, and I have encouraged adult children to create an account for their parents. And go in and create the account, and there's the information there, the Medicare summary notices, which are important to be viewed. They have decided to stop those, and they're available every 6 months, I believe. And that way you can gather the information. It'll have their uh, prescription drugs on the Medicare.gov account. And again, what type of Medicare plan they have, whether it's original Medicare or Medicare Advantage, if they have extra help, or if they have, let's see, I think it's extra help. It's another one. I can't think of it right now. But whatever their health information is, it will be available on the Medicare.gov account.
Okay, excellent. Notice everyone, there is a session survey on your screen. Please fill that out and provide whatever comments or suggestions that you have for speakers. We have pretty much the rest of the year um, through September anyway planned out, but we can add sessions and we want to hear what you need.
Okay.
Felecia, and Melinda, but Felecia especially, would you provide some kind of summary or tie it all together as
Oh,
we end
sure,
today?
sure. The best thing you can do for yourself if you are on Medicare is to take advantage of your preventive services.
Mhm,
Diseases that are undetected, untreated can be more serious when they manifest themselves and lead to more lengthy treatment periods, and as opposed to catching it early if you have your preventative services. If you're concerned with anything about your health status,
mhm,
talk to your doctor.
mhm.
Again, have that open, honest, frank conversation with your doctor about your health status and your well-being.
Excellent. Thank you so much, Felicia, for your information, how you share it. And Melinda, thanks for joining us.
Oh, yeah.
She is your role at the AAA at North Central Texas is what now? I didn't want to use the wrong word. Melinda,
She's our fearless leader.
Uh,
that's exactly, but I didn't know what the term would be she would use,
um,
but She's the boss.
She's
I,
the fearless leader. Yes.
Also,
I
lots
work
of
with my
experience.
colleagues.
Yes, you do.
And
A strong team over there. I think it's telling that people at North Central Texas AAA don't leave very often, do they?
Mm-mm. No, they do
They
not.
retire, but that's about it.
yes. And
Thank,
Xanda, can I
yes,
just say one other thing? We
certainly.
are in the last part. If you have a Medicare Advantage plan
Hmm.
and you are unhappy with it for any reason, you
Hmm.
still have until March the 31st to change that plan.
Well, that's good to know.
Mm,
Everybody catch that? You can change the plan through March 31st.
right. If you have a Medicare Advantage plan
Hmm.
and you don't
Only
need a
Advantage.
reason, and you don't
Mhm.
need a reason, if you're unhappy, change it.
Okay, very good. Very good. Thank you, everyone, for joining us. We will have another session in April, and honestly, I can't recall what the topic is right now.
That's
But
okay.
we try to offer everything, something the last Wednesday or the fourth Wednesday, usually at 10 o'clock, but we flex around people's schedules, and we look forward to seeing or hearing you again. Again, thank you, Felicia and Melinda, for
Thank you.
dropping by.
Thank you.
Thank you always to Minerva, and goodbye and take care of
All
yourselves.
right. Thank you.